Welcome to the MindSeed podcast series, Moving Digital Health. Our guest today is Mohamad Kassem, the International Senior Solution Manager at Altera Digital Health. In his role, Mohamad analyzes and implements digital health solutions to improve patient experience and altogether optimize healthcare management. Thank you for joining us today, Mohamad.
Thank you, Ruben. It's a pleasure. Thank you for hosting me.
Of course. Could you start by telling us a bit more about your background and journey into digital health?
Sure. So I'm currently a senior solution manager at Altera Digital Health, as you mentioned. Originally, I'm an internationally medically trained physician from Lebanon. I did my specialty in internal medicine back there, and my medical education was actually in Egypt. How did I get into digital health? Well, that's always an interesting story because I never intended to do that about 10 to 12 years ago. I originally wanted to become an orthopedic surgeon and go into the sports medicine because I was a gym freak at that time. Fun fact. And I also had interest in pursuing a career which was more research oriented and at the same time like more into problem solving. And at that time the trend was in public health, and because my family members worked for United Nations, I did have within me, so I really wanted to go and do some consulting, try to solve real world problems from a clinical perspective, and even contribute like to shaping healthcare policies and come up with something innovative through research. However, things changed when one of my relatives, who was among the first alumni of Arizona State University Biomedical Informatics program, told me about his program and how it would impact healthcare. I found it strange in the beginning, but it really intrigued me because there's a technology component into that, and I'm passionate about technology and following up on the trends. So I ended up reading more about it, and at that time I was an intern at one of the largest Egyptian medical university hospitals. And I still recall till the present day how I used to go between certain buildings and sometimes take a long walk to get like a old patient report and some x-ray result, and then going back to sign off on it and put it back in the box. You can't believe like how much paper was there and like how many boxes with dust, like how it looks in the movies. So I was like, wow.
Yeah, and all the exercise you got from walking back and forth from building to building.
Yeah, I guess it's a good cardio then. So it was intriguing to me, like, oh, so there are solutions out there and we can actually look into improving that. And I realized that clinicians are not really involved. It wasn't really very popular, and even the information about the domain was a bit vague. So I did start reading more and more about it. I took some online courses until I decided to pursue a postgraduate degree in that and take the non-traditional route for a clinician. So I went into Dalhousie University and I joined the Masters of Health Informatics program in late 2017. And that allowed me to get an opportunity to be an intern at Allscripts, which is now known as Altera Digital Health. And I worked on really great projects, and it was an eye-opener for me, and I could see the potential that I could bring in as a clinician, as well as someone who is getting trained on the technological aspect of it and seeing the business side of things. After all, health informatics is a multidisciplinary field where, as a professional, you'd be the architect for solutions, someone who puts the blueprints and talks in different languages that would the different stakeholders like the clinicians, the engineers, and even like business people would understand. And that requires understanding and experience in all those domains. So
yeah, do you find that you do a lot of translation almost between from clinicians to the technical side, or from the business side to clinicians, kind of bringing all those together?
Definitely, that's part of my day-to-day job, because as a clinician, I understand like the frustration that comes from using certain systems. Clinicians always want, and even nurses, they want something to make their work easier, more streamlined workflows. They don't want an added step into their work. They don't want that burden. They don't want to really like. I want to see the patient. I want to document stuff and be able to see all the information and make life easy. Like I don't want to keep clicking on things. I don't want to use like 10 technologies and some of them are not relevant to me, because after all, clinicians are also humans. Like not every technology that's available out there is always usable. So this is where human-centered design comes in. So that's one part. In terms for the developers or the engineers, usually from my experience, it's all about the logic. So as clinicians, we see things in a certain way, and we have systematic thinking when we approach a patient and try to diagnose and treat a disease. Similarly, engineers do the same, and you yourself, like you know that like there's a logic, if then rule, right? If there is a condition, then I should have an expected outcome. So how would you translate the clinical part of it into the technical part of it? So this is where my role comes in. And from a business perspective, it's about talking about the value proposition. So if I have a solution, how it will solve your problems, how to improve your efficiencies, how much it will save you costs, and streamline workflows and make you grow as an organization, for example, when it comes to hospitals.
Yeah, so definitely a lot of connecting the different stakeholders and bringing all the different perspectives together. Can you tell me about a little bit more about Altera Digital Health as an organization?
Sure. So Altera Digital Health is a global digital health solutions provider that has been around the market, serving almost more than 15 countries for the past 30 years. I know it's a little bit confusing now when we mention Altera. We used to be called Allscripts, but we've been acquired by Harris Computer in May 2022, and that rebranding was introduced as Altera Digital Health as we know it. Our company provides solutions to healthcare providers, to military institutions, and even governments around the world to cater for different healthcare service delivery needs. In fact, our solutions in Canada are used by, it covers almost 40% of the Canadian population, and it would range from electronic health records, health information exchange platforms, anesthesia solution, and even patient flow solutions. And we're very big on interoperability. Our main purpose as a company is to develop technology that connects and inspires healthier communities through fast, flexible, and clinically driven solutions roadmap that enables our clients to attain the digital maturity that they're seeking across an integrated care system.
So that's a lot. Obviously, very big company and a lot of different offerings there. So where do you fit in your role as senior solutions manager?
So my role, whenever I say senior solution manager or solution manager, everybody asks me like, what is that? Like, is it a product manager? Is it a project manager? It becomes confusing. So if I have to put it simply, it's a very cross-functional role. Because it entails wearing multiple functional hats. So I wear the strategist hat, the product manager, the project manager, the facilitator, a visionary leader. I am a researcher. I'm also an educator and a learner. Because when you want to develop solutions, you really need to see everything from a global perspective, have the bird's eye view of things, and see how the different components of a system work together and how you would solve a problem. And it involves a lot of learning. I'm a clinician. I'm not a technical person. However, my role enables me to learn a lot about the technical aspect of it. And I need to embrace that in order to be able to explain why we're doing something to different stakeholders, as I mentioned before, whether for the clinician or for the engineers. And having knowledge about the technology trends really helps you design and think for the future, like how we can improve something that we're having trouble with. And that's mostly product management. So in short, Some would say, "Oh, so you're a consultant?" I prefer to say I'm a health informatician.
Mm-hmm.
And my responsibility. Sorry, yeah.
Yeah, I was just wondering, does your background as a clinician give you more weight in some of those conversations, especially on the clinician side? But with all the stakeholders, does coming from that clinical background and actually having been in that role before make it different than someone, a health informatician that doesn't have that background?
It helps a lot because I know what it's like to be a clinician. I kind of know the thought process, and at the same time, because I experienced the same burnout that many clinicians are facing these days. I know where the pain points would be, and even when I use our system, like the first look I take is I look at it as a clinician. I'm a user. I don't look at it as a solution manager. So I assess like the functionalities. Does it make sense to me? Am I doing like too many clicks? Is it going through a certain workflow? So I try like to create and mimic a scenario, and based on that, I take notes and tell our developers like, this is what's happening. This is the logic. After all, like solution development or product development is an iterative process, and it's all about agility. And as a company, we're really big on agile and embracing that even in our thoughts. Like nothing can be perfect from the first time, but you can still improve it with every iteration.
Yeah, as a user experience designer, you're always trying to put yourself in the shoes of the patient or the clinician and think of it from their perspective. But of course, having actually lived in their shoes before gives you a lot more insight into what that perspective would be.
Well, that's a value I live by. Like I have an unwavering and relentless focus as a medically trained professional working in solution management to actually improve our solution usability and adoption among clinicians.
And what about the international aspect of your role? Do you end up traveling and working in a lot of different countries?
Unfortunately, like I didn't get to travel much during COVID. However, I was able to go to Dubai and attend the Arab Health Expo, which is really big conference that gets all the technology vendors and medical device vendors all in one place from across the globe.
Okay.
However, I do participate in a lot of the international and even regional digital health events. It involves a lot of learning and exposure to different mindsets and best practices from different regions, and even an insight about the competition. To me, like even working so I don't work exclusively for Canada, but I also like participate in our company in projects related to Singapore, Australia, and where we're present across the globe. And I do notice that there are many similarities and the challenges for healthcare professionals, and it's rewarding for me to develop solutions to problems that would have far-reaching impact. If you ask me if I do it again, I would definitely do it.
Yes.
No doubt.
So I'm familiar with, in Canada, the US, the overworked healthcare workers, a very strained system, a lot of clinician burnout. Is it the same in across the globe in all of the countries, or are there some countries that have kind of recovered from COVID and are actually getting back to normal?
So the burnout is actually common across almost most countries. Like even when we talk about North America, we think about like mature digital healthcare systems compared to other regions, and other regions are still embracing those solutions. The main point from burnout is not just about like facing patient surge, but also like the systems. Are they usable? Mm-hmm. Some of the systems are a bit rigid, and I think part of that goes like to the previous 10 or 15 years ago when some of the initiatives like the ONC came in, and it focused more about like the financial aspects of it and like recording everything that you do. So the clinicians are not really sitting on the system to just like put data about the patient, but they're trying also to fulfill the administrative needs that are required by their governments or health authorities. which causes burnout. And we didn't have technologies like natural language processing and even like the voice-to-text technology back then to enable those. And I think now it's starting to improve a little bit.
Okay. So you were recently at the Canada Health InfoWay Partnership Conference. So tell us about what the themes were there and what were people talking about.
Yeah, so it was a great event, very well organized. The topics were really interesting for this year because it focused solely on interoperability, which was the star of the show from the way I see it. Patient engagement, and even the healthcare workforce crisis that Canada is facing right now. I think these topics are very important, and it's great that InfoWay was able to get most of the stakeholders in Canada under one roof to share their experiences and their vision about how they would solve it. And I did a lot of networking in that event also to learn more about it and explore different perspectives. And I'm glad to see that everybody share the same vision, that we need to solve it, and that there are initiatives in Canada and even in other parts of the world to tackle it the same way.
Okay. And so how is Altera contributing or solving some of those issues?
So let's take it one by one. So since these are globally important, like any vendor, including ourselves, would be working towards those. For interoperability, there are actually global standards that guide the communication and the information exchange between the health information systems and even other systems like enterprise resource planning, financial systems, and such. And there are health information exchange platforms like our product, DB Motion, which enables that, and it aggregates patient information from different clinical systems and harmonizes them and makes them available at the clinician hand in a very simple view. And the clinicians can actually add it to their EHRs instantly. So they have like a longitudinal record and they won't lose sight. That is, yeah, and one of our guiding principles in solution management is to create products that are interoperable and that are open. And by that, I mean platform agnostic. So this is one part that we tackle into that. The second problem that I would say is healthcare workforce crisis. I think it's a multifaceted problem. COVID-19 pandemic have aggravated this crisis. As a clinician, I know what a burnout feels like. And there are two reasons, in my opinion, for this crisis. So there is the operational reason. As a healthcare organization, your ability to streamline patient flow between departments and from admission to discharge really depends on the ability of viewing real-time operations, like the admissions, the discharges, the transport within your departments. Like if you're transporting a patient to a radiology department or from ED to an inpatient unit, and even like the housekeeping duties, like to clean the beds and disinfect them and such. In addition to collecting data and forecasting that data to better plan for your resources and manage them in an efficient way is what could solve the problem. This is something that could be achieved through a patient flow solution. Altera already provides this solution. We call it Altera Patient Flow, and it's making an impact in Canada and other countries like Singapore and Australia. Coming to the second problem, second reason for the healthcare work crisis is the human factor. There have been many references to the fact that Canada is facing doctors and nurses shortage. At InfoWay, also, one interesting point was brought up is the shortage or the deficiency in health informatics expertise. And I find it a little bit surprising. But let's start with the clinical staff in the beginning. Patient surges are normal and will vary from season to season. So in the winter, you'll get a lot of congestive heart failure exacerbation cases, COPD worsening, and such. And in summer, in some places, I'll talk about Middle East. You'll have, for example, more food poisoning cases because of the atmosphere over there, right? However, like what most of the clinical staff struggle with is the lack of information about the patient. A lot of the time that we spend as clinicians is on validating the information, either from the patient or their family members. And if you ever encounter a Jane Doe or a John Doe in an emergency department, somebody that has no identity, and you'll have to figure out what's wrong with them and treat them, it becomes stressful. Like you're trying not to harm the patient, you want to deliver the best care quality, and you want to be able to attend to other patients in a timely manner. It is daunting. And I cannot imagine how this thing was during COVID. Like the idea itself scares me as a clinician. I believe, like from a vendor perspective or any solution provider, applying human-centered design principles into our solution design and allowing the portability of certain workflows through mobile apps and being interoperable would contribute in the long term to less burnout and better user experience. In terms of health informatics expertise that Canada InfoA brought during the conference, I believe there is a wealth of untapped talent that are out there. And I would do it. And I know that because I mentor a lot of newcomers in Canada, whether they're doctors or from other domains, as well as our Dalhousie health informatics students when they join our company, and even casually. They have a lot of talent, they have experience, they can do a wonderful job in process improvements and even like guiding product development and identifying certain patterns or trends that we are seeing in the industry, and even becoming change agents and improving healthcare delivery overall. And I'm proud to say that at Altera, we had successful partnerships with Dalhousie University Health Informatics Program, and some of our interns are working now in health authorities and consulting companies and vendors like us. I'm an intern previously. I have a friend who's now working for IBM, and there are even folks who are guiding startups in the digital health space. So
that's excellent. It's great the way they're contributing back to and helping out interns where previously that you were in that position before. It is very rewarding to mentor new grads and help them find their foothold in the field. I want to go back to interoperability really quick because obviously that is a huge issue and has been for many years. And in terms of the big vendors like Altera and others, do you see there's more cooperation in terms of ensuring those vendor systems can work together and data can flow between them?
So at Altera, as I told you, one of our guiding principles, like for a long time, is to be interoperable and platform agnostic. So we do adopt a lot of open APIs in our work, as well as supporting the FHIR standards and HL7 standards. And we're not really stringent when it comes to getting applications and integrating with them. And we're actually working on improving that further because we are foreseeing that the healthcare system overall, like the digital health space, will change over time. Like it will not really be the traditional EHR monolithic system as we know it these days. It'll be more about the flexible and integrated open platforms. As I said, we believe in interoperability and being open as a platform. And we're looking to actually transform our traditional model into something more open and interoperable because most regions these days, if you look at the European health data space, for instance, or UK NHS federated platforms, and even the recent Pan-Canadian health data strategy, everybody's looking for what we call a precision health ecosystem. it's more of connected health communities, right? And these are good starting points.
So looking ahead, how do you see digital health evolving in the next few years?
So based on my recent engagements like at Canada InfoWay and even some of the discussions I'm having with my colleagues abroad and reading across like different magazines and articles, I feel that most countries around the globe are aiming for the same thing. Basically, healthy communities through what is called like a precision health ecosystem. The recent publications that came from Europe, like the European Health Data Space, even the project that NHS in the UK would want called the Federated Integrated Care Services Platform, and even the Pan-Canadian Digital Health Strategy, which was issued back in July, are evidence of where the digital health future is moving, and it's a good starting point to implement changes across participants in the healthcare delivery spectrum. And attaining such a goal will provide two main opportunities from the way I see it. So one would be addressing the digital health adoption barriers, and the other one would be creating a space for niche and patient-centric services, which I think something that will make big vendors to pivot that way. Because, so let's start with addressing the current digital health barriers for starters. The first thing, so attaining it, in order to achieve digital health precision health ecosystem, it's all about the information, and it's really a lot of information, a big wealth of that. So we're talking about data coming from the EHRs, wearable devices, and now we started talking recently more about social determinants of health, genomics, and even environmental factors that impacts your health as an individual. And that data keeps evolving, like every day with new technology coming in, you'll find new data that you can acquire. And it shows you like how complex things can be in order to attain it, and that you need to aggregate the data into one place and make it available for different uses. However, with the current barriers that we have right now, like digital health literacy among clinicians and patients, will take some time in order to achieve it. So from a digital health literacy perspective, I feel that clinicians and nurses, like it's best to implement digital health education programs within the curriculums during med school or even nursing school. For the patients, we can do public health campaigns and even patient advocacy groups, and participating with those and empowering them to actually teach the population about like the uses of digital health, the benefits, how it can be leveraged, and for the patients themselves to advocate further for what they want. Second of all would be embracing a human-centered design by co-creating with users and reiterating, validating, and focusing on the journeys. So focus on the clinician journey, focus on the patient journey. When you know and understand the journey for each user, you know what information you are collecting and what you need to collect, and you make it like a standard. I would say also one of the barriers that we need to address is the cost of adoption and the technology constraints. Part of that could be due to lack of proper planning and communicating clear expectations when trying to procure solutions. Also, the differences between some of the technologies. A lot of technologies these days in the hospitals are legacy systems, and it is very common to see that many systems struggle when they want to migrate some of their workflows and even their information from their current systems into the new modern systems. And that comes with a hefty cost as well. More importantly is a standardization. Many systems collect data, but are we really collecting that based on standards? Are we really auditing that data? Are we collecting that in a uniform way? many vendors and hospitals will say they do, but I still feel, looking at it from a bird's eye view, there's a lot of work to be done, and it's a race between everybody. And I think now, like with regulatory with the supporting bodies like Canada InfoWay, things can improve, and this is also a common thing that many of the other countries are trying to tackle. That's why we're seeing an increased demand on the FHIR interoperability standards and their adoption and their uses. One factor also when it comes to technology constraints is the rapid pace of technology advancement. Like 5 years ago, you wouldn't hear about cloud technology as much as we hear about it today, and its benefits. So, like for a healthcare system, usually healthcare are the late bloomers when it comes to technology adoption. So once you implement a certain system, a new system comes in, and and the healthcare system, like the stakeholders, like, what can we do to adopt it? Like, did we miss it? What can we do? And it becomes
but I think there's a real spectrum of people who are ready for that change, right? You might have a certain group that is really pushing for yes, give me the tools. I want the all the information and all the data at my fingertips. And some clinicians or administrators are like, hey, I'm already overwhelmed with everything that I have. I have 7 different systems I have to learn, and don't give me one more thing. So it's a real I see that challenge of the ends of the spectrum, and how to integrate tools and new workflows into systems that work for everyone.
Yeah, so this is a challenge also for the vendors. So the technologies keep evolving, right? And when you design a technology like cloud computing, it is not only catered for healthcare, but for other industries as well. Some industries will pick it up quickly. Healthcare is usually late on picking up those because of the complexity of the information that you're dealing with, and because it's also related to patient safety. Like patient safety is an important factor.
It's a good thing that technology has to be proven first and shown to be reliable in other industries that are less high risk. So of course that it totally makes sense for healthcare to be a bit of a laggard when it comes to certain technology.
And also it's about the talent, because your technical teams, whether in the hospitals or even like from a vendor side, like when you don't really have a good understanding of the complexity of healthcare data and the impact that would like if you have missing information or if that information was breached for any reason, it makes it harder. That's why, like, I feel when we want to design a solution, we really need to focus on the now, design something that makes common sense for the user at this point to solve their problem, but at the same time keep a space to think about the future. So don't design something and just stick to one technology. Always keep a space or a room for an advancing technology, for something new. Everybody now is talking about data fabrics, right? Like I was using something and I stored everything on a hard drive. How can I migrate it to the cloud? How can a data fabric allow me to gather the structured and unstructured information? How do we manage those? Are we able to query those? What are the uses? It is fast-paced environment, so we really need to keep an eye and always keep a room. And don't really restrict yourself in design. Always try to keep a space. You're a developer, you would know more than I do on this, but I think we kind of share also the same vision when we look at things from a future perspective.
Yeah, and sometimes when we're prototyping a new solution, we actually look at ways to minimize the amount of data we're collecting, especially in personal health information, so that we can move quicker with the solution in terms of testing it and with users and iterating on it based on the user feedback, because that it does allow us to move faster. And then once the solution has been proven, then we can say, okay, now it's worth the time to invest in making it PIPEDA compliant and or SOC 2 or whatever the regulations are for that specific hospital or environment. But at the very beginning, we look at ways to how can we move fast before having to encounter some of those hurdles that necessarily slow the project down, take longer in order to be in compliance.
Exactly, and this brings me to the second point I wanted to say in terms of opportunities from a precision, coming from a precision health ecosystem, is basically opening a space for niche and patient-centric services. So for many vendors and the traditional EHR vendors, like it is big enterprise systems, and making changes and accommodating for most of the users can be challenging, and keeping that space sometimes is challenging. So like there is a room for you'll always find gaps. Like for example, some mental health services or even information about it is not really well collected in most of the systems. There is a deficiency. You might find gaps in fem health, for example, which is digital health technologies cater to women's and child's health. So this is where smaller vendors or startups can actually tap into that ecosystem and actually collect that data, and even through the interoperability feed it to other systems. When you have such a ecosystem and have all the data in place, like many users can be able to access that data once it's governed and secured. So you have the EHR vendors having visibility to the patient's journey from birth till the present day. They'll know everything about the patient. Governments can, and like health authorities and even research institutions can do studies and run reports and keep track of things and even forecast for future events. Insurers and pharmaceutical companies can even get that data once it's de-identified and leverage it for improving their products and even tailoring their services toward the patients. Right, and even
giving the patients access to their own data
exactly,
as well.
and that's the main and that's the main purpose, like from these initiatives, is granting accessibility to that patient health data to different stakeholders in a secure and governed manner, and at the same time give the patient the access and the control and the ability to see what's going on with them, and even to ask for more services, right? After all, the patient has the voice and has the needs, and will always say like, I need this service, I'm missing on this and that. And that's part of also like why digital health literacy is required as we speak these days, in order to achieve this precision health ecosystem when we want to the future. Because it doesn't make sense to give patient all access to health information, and at the same time the patients are not empowered enough, or really have an idea how can they leverage that information to their own advantage.
Sorry, I just wanted to touch really quickly. It was really surprisingly recently when OHIP changed its regulations around the payouts for virtual appointments. So it drastically reduced the amount that a virtual only clinic can get for a virtual appointment, which has really impacted a lot of virtual only clinics out there. A lot of them shutting down because the fee structure just doesn't work for them anymore. Which is just so mind-boggling, because it's going to push a lot of people who were using these virtual appointments over to the emergency room because they don't have family doctors, and just overburdening that system again. So I think there's also an onus on government to really pave the way for digital health solutions through legislation and regulation. And not stifle innovation by essentially turning the clock backwards.
Politicians and government officials are people after all, right? So they're also patients. I think when it comes like to an incident like reducing the fees for virtual care, like, and this is my assumption, like probably some would see it as like you're just seeing the patient from your desk and you're not really doing the full diagnosis, and you're not really like examining them like you have in real time, so like you shouldn't really get paid the same amount. Some people would regard it from that way, but the main benefit and the main use of virtual healthcare services is to actually ease the burden on the acute care systems, so the hospitals.
Yeah, exactly.
And at the same time, there are conditions that could be treated over a phone visit and over video conference. And like the virtual visit is still, you're engaging with the patient, you're getting information about them, and sometimes it doesn't really require the patient to come and even add to the surge, even in the urgent care clinic or your clinic, right? You keep a space open for other patients for more urgent stuff or like more serious conditions. We really need to look at virtual care as a way also of engaging with patients. Like they're still a human, you're still engaging with them, you're communicating with them. We're not saying that you're actually dealing with a chatbot or a robot, right?
Yeah, and of course the hybrid is ideal, right? Have in person when you need it and virtual when you need it. But it seems, when you can't get there in person, why not optimize and enable virtual appointments as much as possible?
Yeah, the technology is there to help the people. Well, I think it's an evolution. As I mentioned, it's not a straightforward approach, and if you want to achieve the precision health ecosystem vision, it will require a significant amount of work and robust planning and a lot of implementation effort.
Certainly. Well, I know that you and Altera are part of that movement, solving problems and moving digital health forward. Are there any other, recent innovations or accomplishments you can share before we wrap it up today?
So we've recently introduced Sunrise Air to the market back in July. Basically, it's an improvement for our mobile application, and it caters to personas. And by personas, I mean like the clinician, the nurse, the billing administrator. So when you open the mobile application, you don't really just see like all the EHR in the application, but it's more of a tailored experience. Like as an acute provider, what are the main workflows that I need to cater to? How do I view the patient, and how do I do certain things like clinical documentation, ordering from the mobile form, right? An ambulatory persona will have a little bit different approach because the workflow is a bit different. And Sunrise Air is built to actually introduce that. We've brought the acute provider to the market, and we're bringing also the nursing workflows and the ED provider sometime next year. So stay tuned. And in terms of how Altera is also working to transform its products to meet with what we see as a precision health ecosystem, we're basically taking our solutions and the modules within that, and we're containerizing that in order to improve the solution delivery to our clients, improving the upgrades, and go with less downtime using cloud technology, and at the same time reduce the costs on them. And it's a continuous work, and I look forward to the day when we actually see a precision health ecosystem in place in Canada and other parts of the world. And I'm happy as a health informatician to be part of that work.
Yeah, amazing work, and keep us updated on what you're up to. And for everyone that's listening, thank you so much for joining us today on Moving Digital Health. If you enjoyed this conversation, please go to movingdigitalhealth.com and subscribe to the MindC newsletter to be notified about future episodes. Thank you.